Welcome to this three-part series on harm reduction for healthcare settings. Together, we will discuss what harm reduction is, how it can be applied to improve health outcomes among your patients, and strategies to begin incorporating harm reduction into your training, policies, and workflows of your health center. Harm reduction is a set of principles that can be applied in a variety of settings and contexts, particularly within healthcare. At its core, harm reduction is a set of practical strategies and ideas most often thought of as an intervention for substance users and an approach to reducing the negative consequences associated with substance use. However, harm reduction is also a movement for social justice built on a belief in and respect for the rights of people who use drugs. A common misconception about harm reduction is that it enables or encourages drug use. However, a better way to describe it is that harm reduction focuses on the harmful outcomes of behavior, rather than the behavior itself. Many harm reduction advocates also support the goal of people working towards abstinence, but recognize that for many people, this process takes time. In the meantime, while the person is still using, both they and the people around them are still vulnerable to harm. Harm reduction says, how can we help this person avoid the most dangerous aspects of their drug use? Consider the fact that all people engage in activities that carry some risk and are unlikely to simply stop. What strategies can be used to limit their risks? This concept can be applied beyond substance use, including for chronic disease management such as diabetes or hypertension, both of which are common among patients in U.S. health centers. Harm reduction is a concept that can apply to everyday activities. For example, seatbelts or wearing helmets or life jackets. Many activities require us to consider the risks and steps to reduce the risk to harm to others and ourselves. We hope this short introduction has provided you with a broad understanding of the philosophy behind harm reduction. Let's dive a little deeper into some basic facts about harm reduction and how it relates to your work in healthcare. Fact 1. Harm reduction advances a patient-centered model of care and addresses social determinants of health. The patient-centered medical home is a model of care that puts patients at the forefront and works to build better relationships between patients and their clinical care teams. Research shows that using this model can improve quality, the patient experience, and increase staff satisfaction, all while reducing healthcare costs. Given that harm reduction is based on respect of the rights and choices of people who use substances and has no agenda beyond keeping someone safe, utilizing it ultimately advances a patient-centered model of care long-term. Harm reduction advocates also understand that healthcare goes far beyond a patient's clinical needs and must address the basics such as food, shelter, and social support. Consider how difficult it would be for a diabetic patient to manage their blood sugar and insulin if they are experiencing housing instability. The same concept applies to patients struggling with substance use. Given the focus on the broad impact of the social determinants of health at both the community and individual levels, deploying a harm reduction approach will only serve to strengthen that focus to the benefit of patients and staff. Fact 2. Harm reduction supports integrated behavioral health care services. In 2019, the Health Resources Services Administration, or HRSA, awarded nearly $200 million to increase access to mental health and substance use disorder services at 1,208 health centers. HRSA also awarded nearly $70 million to opioid workforce expansion programs in 2019. Primary care providers play a critical role in the treatment of substance use disorders and mental health services. They integrate early substance use disorder prevention services, provide safe and effective pain management, and implementation of medication-assisted treatment programs itself. A key example of harm reduction as part of integrated behavioral healthcare services. However, from a patient-level perspective, stigma about mental illness or substance use is a major factor that contributes to lack of treatment or undertreatment. Without effective primary care screening for behavioral health problems, patients may not share concerns with their primary care providers. Even if diagnosed, patients may passively accept a referral from a primary care provider but choose not to keep the appointment because of the stigma. Consider a patient who is an active opioid user arriving at a local health center seeking care for a soft tissue infection from injection drug use. Given the nature of the type of wound, the severity of their substance use and risk is immediately evident. Imagine they are addressed in a manner that lets them know they are unwelcome or not a preferred type of patient. Their interactions with staff and the immediate focus on a need to get clean remind them why they seldom seek healthcare services. Their primary care provider offers them a referral to an outpatient addiction program, but they already know they will not be showing up to take this appointment. How could the interaction with this patient be improved and increase the odds that the referral will be followed through? Research on integrated or collaborative care models demonstrate that many patients can be effectively engaged and treated for substance use within the primary care setting when harm reduction is a key component of that approach. Fact 3: harm reduction is evidence based and cost effective for working with the most vulnerable populations. As you already know, health centers are community based organizations that serve people with limited access to healthcare. This includes low income patients, the uninsured, those with limited English proficiency, and individuals and families experiencing homelessness. Individuals who have experienced homelessness are more likely to struggle with mental illness and substance use disorder. Embracing harm reduction as a foundational framework will advance the goals of serving the most vulnerable, using the most effective, evidence based approach to achieve better health outcomes. But the fact remains that the stigma and misinformation continue to build barriers that only serve to harm those in need. A 2019 survey of injection drug users found that experiences of dehumanization in healthcare settings were common, with many participants perceiving that they had been treated unfairly or discriminated against due to their injection drug use. As participants anticipated this type of stigma from healthcare providers, they developed strategies to avoid it, including delaying presenting for healthcare, not disclosing drug use, downplaying pain, and seeking care elsewhere.
To learn more about how harm reduction can help achieve better health outcomes, view the next video in this series.